All right, welcome to News Talk with Brandon and Bob. I'm Brandon Jones, sometimes called Pops on Pop Culture, host of What's Your Story, and with me is my longtime friend, someone that you know and love, the editor-in-chief of Outbreak News, the infectious disease guru himself, sometimes affectionately called the worm and germ guy. Yes. Yeah, you know, I call him Bob. Some people call him Robert, not Bobby, not Rob. Robert Harriman. Here we are, Bob. Here we are live with our first show. Bringing it in the middle of our Florida monsoon.
We are here.
We are.
We are here. Big storm going on, but nothing's going to stop the show.
Yeah, well, we say that, and then the light will go out.
Yeah,
so we're going to praise God that this goes off without a hitch. So it's our first show. We're so excited. We're bringing back that old dispatch radio feel of things, trying to cut through some stories, give you an idea of some things that we're paying attention to, hopefully cutting down to your time, taking in a bunch of this garbage news and that kind of thing. So
let's take a look at it.
Yeah, so right off the bat, I want to jump right into COVID. I think that's the story that's consuming everything, and we can cue the little CDC alert at the bottom of the YouTube version of this. If it's not there, folks, it will be there.
Yes, it will.
But I want to jump into that first, and I want to start with I go to a site called worldometer.info. Worldometers.info. I'll put a little link there, and it's kind of basically just a bunch of data.
So it's similar to the Johns Hopkins one.
It's a little bit more comprehensive for me in that it pulls in a lot of real-time data. It goes countries. You hit countries. It breaks it down into okay. So, but where can people get good data? Like, people right now are probably given all sorts of data. When does it report? How do people even sift through the data? What do you do? Do you use Johns Hopkins? Do you use something else?
Yeah, I basically use Johns Hopkins, and then I determine what's going on the Johns Hopkins map, and then I go to that Ministry of Health. I get it straight from the source, whether it be Russia or Brazil or whatever the hot spot is at the time.
Right.
So I try to get it from them. Some of them are very interesting. Brazil is, of course, they're a very controversial leader. Put things on there promoting the way Brazil's handling it, even though things don't go that well. Russia's kind of the same way. Venezuela, they're blaming everybody for COVID but themselves. So it just varies. But I do kind of steer clear from a lot of the mainstream media because it's very sensationalized, and I try to avoid that as much as possible. But sometimes you do get some good quotes out of it. But it's hard. It's hard. I mean, it's hard to find good numbers as far as particularly the models. Models are all over the map.
Right. So do you focus more on total death count, total case counts? What piece of data do you kind of look at? Because for me, I've kind of drifted away from total cases, because if we run 1 million tests, we're going to have more positives than if we run 100,000 tests. So I've kind of focused just on the graphs. And again, if I go to Worldometers, at the bottom, there's just graphs. And you can just kind of see the charts to kind of see, and really for the last 30 days, we've kind of gotten very, very flat.
Right.
But talk a little bit about which pieces of data are even worth paying attention to.
Well, you're right. You're 100% correct. I mean, the case counts is a direct result of the massive testing that's going on. In the United States right now, for example, we're doing about 400,000 tests a day.
Oh, it's a lot more than I thought there was. Yeah.
It's really funny. I was watching this interview with Mika Brzezinski the other day. She has some kind of expert. Everybody's an expert, right? And
except for you. You haven't been invited on CNN yet, as far as I know.
Haven't.
Okay,
I don't
just
think
checking.
it's going to happen anytime soon.
Yeah, the worm and germ guy doesn't make it.
No. But this expert said we should be doing 23 million tests a day.
23 million, really? 400,000, 23 million. We have just a random number.
Yeah, but which is, there's not supplies, there's not people to do the tests. It's
just an absurd number that somebody comes up with.
So I like I said before, cable news I definitely avoid because they are so sensationalized. As far as numbers, I do look at case counts, particularly if there's a headline that I want. So Brazil went over 400,000. I need that information. But to find out what's really important is I do look at the death count, but not by itself. I look at it, if it's available, I'll try to break it down by age. And as you can see in almost every country, it's 80, 85%, maybe a little bit less of the fatalities are in people 65 and older. And as far as from a policy aspect, that's clearly the most important one, because you don't want to shut everything down with the younger people when you can kind of just try to protect those vulnerable people.
Right. And
you wouldn't have economies in turmoil right now. Right. But so, that is something I look at, even in Florida. Yeah.
So let me review. You run Outbreak News Today for us. You're pulling data directly from Ministry of Public Health sites, verifying a lot of the guidance through Johns Hopkins, trying to get into where there are raw numbers and that kind of thing. For me, I like I said, I kind of use just because Worldometer just kind of populates in real time. It kind of gives me some charts and graphs. I can see some of that kind of thing. Where do you see kind of our current state in that? And let me ask it in a compare and contrast. What do we know now in May, as May's coming to an end, that we didn't know, let's say, in March and April? Because my tone has changed dramatically, right? I was erring on the side of conservative. Yeah. We were seeing numbers. My concern was we were seeing numbers that were still doubling, right? So 250 becomes 500, becomes 1,000, becomes 2,000 every 3 days. And until we knew what that would look like, not just in New York City, but everywhere else, I was like, we have to err on the side of caution at least a little bit longer to get data. But now we've gone too long. We went way past knowing that. The graph actually didn't get flat. It actually been down. Yeah. Where are you at on your scope of what today looks like compared to, let's say, March and April?
Well, I would say...
Goodness, our storm is rolling through, folks. This will be a video to remember.
There's been a lot of research. Of course, there's tons of money being dumped into research. Sure. and testing and everything else. A lot of good research that's been done. So we have learned some things. What have we learned? We've learned about ACE2, and that's angiotensin converting enzyme 2, I believe. And why is that important? That's kind of the doorway for the virus into the body.
Right.
And why is that important? Well, we're seeing around the world that men are having more severe cases. They are higher rates of death, and that's because men naturally have more of this ACE2 in their body.
Okay, so we have more ACE2,
right.
So we have more gateways to get more virus. So just biologically, there's a difference between a genetic male and female in the amount of ACE2, the receptors that we have.
Yeah, according to the research. Yeah,
okay.
That's what they're saying, and I believe it. Also, we know a little bit about the severe pathology, and that is something called cytokine storm.
Yep.
You've heard of that? You've heard of that, right?
Yeah.
So the immune system just goes wild, and basically you start getting all this massive inflammation, and frequently you can die from that.
As I understand it, the body almost attacks itself. It gets confused by what is infection and dead cells it's supposed to destroy. It'll destroy healthy tissue as well. And once you're on that slippery slope, they haven't really found successful ways to really stop a lot of that in this elderly population.
It's really hard. Hard. And another thing is, as far as pathology, I think that's where we've seen a lot of progress. Is a lot of people are, particularly in the African American community, is the issue of blood clots because of this. So now that they know this kind of stuff, they can give blood thinners and that kind of therapy to help these patients. So I think those things are pretty important. Let me check my list to see what else I put down here. Other parts of pathology is somewhere between 60 and 80% of people that experience COVID experience a loss of taste and smell.
Right.
Yeah, so that's kind of interesting.
And that was a key indicator, because I know I've been tested basically 3 times. I had an antibody test, then I've been tested before procedure and right before procedure. And there's a lot of focus on shortness of breath and loss of taste or smell. And those were 2 huge parameters that they were asking for every time, asking multiple times, that kind of thing. So I guess that's kind of a very common theme that we have seen from because I don't really count the data from China. I count the data from Europe, and then kind of going forward. So that's pretty much how you've approached it too, or some of that data. So I'm not going to disregard China 100%, but I'm not going to take raw numbers. I'm just going to be like, all right, whatever.
Well, and there's other countries that are like that. I mean,
you mentioned Brazil and Venezuela. We're not going to get good data.
Well, Brazil's probably pretty good. It's just that they're putting out little statements on their website like, hey, we're doing everything we can, that kind of thing. So they really kind of promote that. But Even at first, I was wondering about Russia. It's like,
they had no cases for the longest time. But we know they shut their borders down. Like, there were really border shutdowns back when China was flared up, Europe was flaring up, and they literally were shut. You could not get in and out of Russia. And then we have this massive surge now in the last year. Let me shift gears, because I have to get into a little bit of the politics with this, because I really want to do a compare and contrast with what your thoughts are. I think there's been a couple of great articles and talking about the difference between liberal and conservative. And this was a great article. I think this was from the freethoughtproject.com, and we'll put the link in the comments so folks can check this out for themselves. The difference between conservative and liberals. And Jonathan Haidt, I love the book, The Coddling of the American Mind, a great book if you haven't got a copy of that. And it basically talks, and there's a quote that says, Democrats tend to be more concerned because the liberals have an intense appreciation for the care and harm moral pillar. And GOP governors, while these governors in these states no doubt value care harm, their moral framework likely gives them a heightened concern of other social considerations, particularly those civil liberties. So we tend to just kind of throw these comparisons of how things are running in New York and New Jersey in the same conversations of how, let's say, Ron DeSantis is running Florida or how Texas is running, that kind of thing. What are your thoughts on how do you think there's a difference of philosophy that's driving a lot of that?
Yeah. There's no doubt about that. I think this has really brought out a very authoritarian streak in a lot of people. I think that this is representative in the New Jersey governor, the New York governor, the mayor of New Orleans, the mayor of St. Louis. They've all, at one time or another, used the strong arm of government to try to push down civil liberties, and they've been very successful.
Does that surprise you? I mean, let me read the quote that this article used. They quoted Governor Phil Murphy, this is of New Jersey, and he says, during an interview with Tucker Carlson in April, I wasn't thinking of the Bill of Rights when we did this. We went to first of all, we went to the scientists and said, people have to stay away from each other. So literally it was almost like having an agenda. It's like, all right, here's what we're going to do. The scientist said that. He's a scientist. I'm not a scientist. Okay, that's what we should do. Yeah. There was no pause. But we see other states where there's like, well, we're not doing anything until we really kind of see what's going on.
And that's because there is a lot of unknown. And, I understand that a lot of people want to rely on the scientists. I do also. But I think there's a big picture concept that's being left out. Everybody, if you're anti-Dr. Fauci, for example, you are like the worst person in the world. You don't believe in science. You got to remember that. And I'm not an anti-Dr. Fauci person. I believe he's a brilliant laboratory immunologist. I have no doubt about that. You got to remember, he's been around since Reagan. He's the consummate bureaucrat, and you can tell that when he's speaking too. He's a politician,
right?
And he said a lot of things that were not right. Early on in January, he said that this is nothing to worry about. In late January, he told us not to wear a mask at one time. Right? He told us that we're going to have to be shut down until we get a vaccine. Right. That's a little crazy, right?
Yeah, right.
And then not long ago, he said that there's no guarantee that the vaccine will even work. So he's kind of, if you're on camera that many times, you're going to say things. I get that.
Sure.
But to take his word as absolute gospel, I just don't. And it's unfortunate that other scientists who may disagree aren't allowed in the public sphere that much. You heard about the doctors that were on YouTube, and they got their video taken down.
No. It's become very clear that there's kind of a so to Jonathan Haidt's point. Of the feelings versus facts, right? Because I'm kind of a believer. I've done a lot of data at one point a while ago of how there's kind of like these two massive voices in the blogosphere of like the Daily Wire on the conservative side and the Occupy Democrats on the leftist side, and that these are the two main sites that have grown the most in, let's say, the last 2 years, right? But when you compare the data and what they're reporting on, it's like two completely different worlds. That is kind of what we're also seeing with how the outbreak is sort of not only approached and reported on. So, for instance, we have the Dakotas where nothing ever happened. Like, no one ever saw a need to do much. We see that even in Florida. We have whole counties that are sitting on like 10 cases and 2 deaths, Meanwhile, most of our stuff is Miami, Dade, Broward, Palm Beach. It's in this one pocket. Again, it's population density, right?
Yeah.
So, but when we look at the feelings and the fact things, is this just another piece of that, or is it something that's different? Is it brought out? Is, like you said, it's kind of unmask what's there, or is it something else?
Well, I think that's part of the program. I mean, this is perfect scenario for Bill Clinton. He knows how you feel and that kind of stuff. Why do you think Andrew Cuomo has an 80% approval rate? Because he's the way he's talking to people, though he's done many disastrous things in that state.
Yeah.
But he's doing those noon presentations every day, and I work with a bunch of people who think that is the greatest thing ever. And if you listen to Fox or watch Fox, they will point these things out. MSNBC won't touch any of the mistakes he made, like the nursing home issue,
right,
and other issues like that. Telling people that you want a job, become an essential worker.
Yeah.
I mean, that's not.
They didn't clean the subways.
New
New York lost my respect. It was in early April. I remember it very vividly. It was about the week of between April 2nd and April 6th. There were all these photos that were being released. Subways were running. Subways were jam-packed full of people.
Yeah.
I would say that maybe 10 to 25% of the people that were in these photos had masks or any protective equipment at all. The doubling of cases and deaths were exponential every single day in New York. We find out not only was that continuing, they were doing no proper cleaning of any of that machinery that we know of.
Recently.
Yeah, so not until like May. So almost a whole month was happening. So of course you're going to have a stronger likelihood of expanding the outbreak or again creating that faster slope of that curve, where as you have other areas where we don't have subways in Florida. We don't have a huge look at how at Georgia with what Governor Kemp tried to do, where almost everything was localized in like 2 counties, Atlanta, this general area. Yeah. The rest of Georgia, it was almost non-existent, and I don't know. So
the stuff, I think a lot of it in New York too. It was very political, because you got to remember when Trump kind of was like banning travel from Wuhan.
Yeah.
Stuff, right? You had Cuomo coming out saying, "Yeah, go out, don't be afraid." The health commissioner, Cyrus Barbeau, I actually did a video on her. She was out there, go to Chinatown, doing all this kind of stuff. Yeah. And De Blasio was just as bad.
Yeah, De Blasio.
And this went all the way into March.
Yeah, Nancy Pelosi was doing this in California. They've all been but it's 2 different worlds, right? We're getting 2 different pictures.
Yeah.
There's black hats and white hats for a lot of people. All right, so I want to finish the segment on like, where do you land in these extremes? Where, if you had to on a ones that are this extreme and you're here, where do you land as the scientist in all this? You've been doing infectious disease this whole time. I always joke. I said I think our site is probably one of the, if not the largest, it's one of the largest sites in the world where we are not backed by governments or universities or anything like that. It's a privately run, owned infectious disease site. So where do we land from your perspective?
I mean, how do I look at it?
I don't know. However you want.
Yeah. And my perspective is, before I was told I should wear a mask, I was wearing a mask. My wife was wearing a mask when she was working. She has a nail salon. They did close down salons. She stayed home. Mm-hmm. Fine. We still wear a mask all the time anytime we go out.
But that's to protect other people from you sneezing or coughing on them.
That, and plus I don't want to bring anything home to my elderly mother.
Okay.
And so there's a method to the madness, but I always took it seriously, and we talked very early on in the pandemic, but I was never hysterical about it, right? Just you look at your own situation and determine how do you keep yourself safe and your family, and then that's kind of how I handled it. Clearly, I wouldn't anyway, but clearly I wouldn't go to a bar or a rock concert or any kind of...
a populated area during any of this time.
Because that's just not smart.
Where are you at now on, like, let's say a populated area? Let's say that Disney's going to open up with some different restrictions, let's say sports teams, something like that. Where are you at on, not necessarily what you would personally do, where do you think some of the risk is on sort of a scale of things?
Well, I think the risks are really going to be minimized, because I've seen some of these plans, and they're going to have that social distancing in place. So I think, especially those things are outdoors, so I think the risk is a lot less too.
Yeah.
So my concern isn't there. Could I be wrong? Of course.
Sure.
But I don't have a lot of concern. I think I thought DeSantis kind of stumbled out of the gate, but I think he's done a decent job. And he took a lot of flack with Jacksonville Beach and some of those other things, but for the amount of nursing home patients we have, it's been pretty minor. I shouldn't say minor.
I always say one last question, but I always think of one last question. We're probably getting long on our segment.
I do want to talk about the death toll real quick, though.
Okay, go ahead and hit death toll, and I'll ask you one last.
And it's interesting. That is one of my questions, though, is about the death toll. And I've asked this to experts I've interviewed on the podcast, Outbreak News Interviews, and they never really gave me a good answer. So I did my own research, and most countries follow the WHO guidelines for determining death. And it's basically, if it's tested COVID or even suspected COVID, rubber stamp it as COVID, right? That's the cause of death. And there are examples that I read, the only ones that were not COVID were, did you come in, did you have heart issues, did you have a heart attack? Not COVID. I mean, so it had to be very, very strict like that. And most countries around the world are doing that. And I suspect that the case count is much higher than it is just because of it's around. It's a virus. It's not going anywhere. It's going to do its thing. So I mean, if we live in fear, we're going to have a lot worse problems.
Sure.
And I suspect the death toll may be less. And this is why I say that. Colorado recently, the governor, a Democrat, had them reevaluate the death toll, and it was like at 1,100. And next day they dropped, or next week or whatever, they dropped it down about 250 fatalities. And the one example that really stuck out in my head was there was a guy who died, 35 years old. He had a blood alcohol of 0.55. That's fatal.
Yeah.
0.30 is fatal, and because he was positive for COVID, that's what they called it.
COVID,
when it was clearly alcohol poisoning.
Right.
And so they may have been the trigger, so they went through all the records and they chopped off a bunch. Now, worldwide, and I'm going to use Russia as an example, and I'm hoping, I don't know if it's true or not, but the World Health Organization and many countries are asking Russia, how is your death toll so low? They got 400,000 cases and maybe 4,000 deaths, right? And so I had to dig around, and I found an explanation at the Moscow Times. And what they said was that Russia, unlike most of these countries, they're doing autopsies on up to 70% of the fatalities.
Oh, wow.
So that's a good way to...
So they're going to look at the actual cause of death, the complication that's going to be expanded on by having COVID. So let's say respiratory failures and pulmonary heart disease, different things that we know would be the...
And that's a question I bet.
Actual cause of death.
How do they truly know the cause of death without an autopsy?
Yeah. And I
got 70% of 400,000.
Yeah, and I would contradict your data in that it to make it even more unreliable. Early on, again, Italy, right? Videos were happening through Europe and UK, and many situations in places like Italy and Spain. Patients would come in. They already have shortness of breath and a fever and whatever. They weren't even being tested. They don't have enough tests, so why are we going to waste a test? We're just going to treat them as a COVID patient. Well, is that a false negative, a false positive, or how are they going to code? I don't even know that we know the answer to some of that kind of stuff.
And there's a lot that has to do with the test, too. I mean, I don't think a lot of people... I mean, it's done by... The test that's common is real-time PCR. Very good test. However, even Hopkins came out with a study this morning, and it was like, depending on what time during the infection... They're warning people of false negatives. If it's really early, you're going to get a false negative. If it's more than a week later, possibly a false negative. So the percentage varies based on what day of the week.
Right.
I mean, other than Trump, who gets tested daily.
All right, well, let's wrap there. If you do have questions for Bob, or you want to kind of dive anything we didn't get to, give us some ideas for next time. We'll get to those questions. We always kind of catch those up on the next episode, those kinds of things. We're going to take a little quick break, get to another segment. Thanks for joining us on our first episode of News Talk.